Dumbbell Romanian deadlifts, or RDLs, are similar to the barbell version of the lift and can be done on one leg with variations in holding the weight. This video is going to cover each of these variations along with muscles worked. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise can help prevent and slow the progression of type 2 diabetes. RDLs work the posterior chain, and they're an excellent exercise for isolating the hip extensors, which play an important role in explosive forward and upward movement. RDLs are typically used to strengthen the glutes and hamstring muscles involved in hip extension, along with the spinal erectors in the back, and they're a foundational movement for learning the Olympic-style lifts like the snatch. From a standing position with heels under hips, holding dumbbells at hip level, put a slight bend in your knees. Instead of starting at the ground like a conventional deadlift, an RDL starts in a standing position. Squeeze your chest to the ceiling and brace your abs. Without changing the knee angle, begin to drag the dumbbells closely down your thighs while keeping your arms straight and back flat. Once you reach a point where you can't go down any further without sacrificing your flat back, you'll likely feel a stretch in your hamstrings, and it's time to come back up. Drag the dumbbells back up close to the thighs while still maintaining that flat back. It's important to keep the dumbbells close to the legs as this reduces torque in the lower back. The neck should stay in a neutral position throughout the movement, which will likely have you looking down in the bottom phase. Please hit subscribe if you're finding this helpful. A common mistake with the RDL is the chest caving and upper back rounding as you bend at the hips. To prevent this from happening, it may be useful to first practice the movement without any weight at first, and just focus on sliding your hands down your thighs with a proper back position. Another common mistake with the RDL is the tendency to bend the knees in the downward phase. Resist this temptation and maintain that slight bend. If you want to incorporate balance training, more core activation, and reduce strength imbalances from one side to the other, the single leg RDL is a good option. Hold the dumbbell by your side in your left hand. Hold your right arm out to the side to help balance. Begin to move your left leg to the back wall while allowing the dumbbell to move towards the floor, bending at the hips with a slight bend in your right leg, just like the previous movement. Think about the torso and the leg that's moving backward operating as a single unit. This exercise can also be performed holding the dumbbell with the hand that's on the same side as the working leg. If you hold the dumbbell in the hand opposite of the working leg, the dumbbell positioning serves as a counterbalance during the movement. Holding the dumbbell in the hand on the working leg side is more challenging balance-wise, and it may require more core activation to maintain that balance. Thank you for watching.